sorry, what, 6 o'clock, I'm sorry, I'm jumping ahead of myself. All members are currently present, and if we could start with the Pledge of Allegiance. I'll stand.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, first item on our agenda for tonight, Mr. Matt Ronan from Skin Deep Tattoo would like to speak to us. If you don't mind, I know I just introduced you, but if you don't mind saying your name and address for the record.
So my name is Matt Ronan. I reside in Brockton. I've been licensed in 19 municipalities in this state. 26 years ago when I first moved out here, I wrote the regulations that the state disseminates out to the municipalities with Ms. Jane Gallahue of Quincy. I'm here to address the age limit wording in your regulations, mostly for ears, but would also like to address certain other piercings. There are many that I will not touch under the age of 18, and that's just professionalism. But cartilage piercings, nostrils, septums, those you have a large constituency that the parents have absolutely no problems coming in with birth certificates and the proper ID and signing for them, which I'd like to start at 16. But earlobes, as I've done throughout this state and nation, I won't touch any child under the age of 6.
Does the state allow, with parental consent, do they allow the nose and?
Yes, ma'am.
Okay. I don't have the state regs in front of me, I only have our regs. Do you guys know what page?
Oh, yeah, page
piercings
6.
on?
I see what restrictions
Thank
on
you.
6.
I was looking for that earlier. All right. So in the state regs with parental
The
consent.
state regs allow for dissemination by municipality for that. There are some municipalities in the state that allow younger. I would like to not go that deep, so.
Matt, why is the, just out of curiosity, why is this being brought up today? Is there a specific
I
clientele?
am new in your municipality as a body piercer, COVID. Most of the shops I've worked at are either on or across the street from universities, and COVID has them down to 10% capacity.
Right.
I can't make a living that way, so Michael, who actually was a client of mine when I owned a body jewelry manufacturing shop in California, and I first started with him in Quincy, that's, he said, come on in,
Well,
set
welcome.
up shop, so.
Okay.
Well, I'm looking at the Town of Abington's regulations, and under Section 3, on exemptions, it exempts individuals who pierce only the lobe of the ear with a pre-sterilized single-use stud and clasp system. And then the specific restrictions for the establishment, as I'm reading it, says no tattooing, piercing of genitalia, branding, or scarification on anyone under 18. So, as written in our regulations, the exemption should be acceptable for ear.
I hear you, and the regulations that I was able to pull offline didn't have that.
Do you have the regulation that you saw worded anywhere with you?
No, I don't. I have the regulation from the state that Bruce Ayers
Sure.
did. I paraphrase, I just did it in the car because my wife took my car and
Sure.
that, but
I just didn't know if you had the what you saw worded with you.
From Abington?
From Abington.
Yeah.
No, I
No.
don't.
Yeah,
It's
okay.
in my car, which my wife.
Aren't these our regs?
Yes.
Yeah, these
So
are the most
on the
up to
bottom-
date.
Okay, so on the bottom there, all the piercings that you say you want to do, besides the lobe, the cartilage, the nose, I don't see any of those listed in C, under restrictions. So, I don't know, how does that, like, I don't see any of those, like your nose or in these
So I think C is.
restricted body parts.
Yeah, so C is fully restricting them. And then I think A is restricting things under the age of 18.
Yes, and none of those are also nose or,
Yeah, it doesn't specify
You
It
want
doesn't
eyebrows.
ears.
specify what is.
Yes, and
so
I
there's,
personally have no problem with and uphold the nothing with genitalia. I do not do skin braiding. In fact, I don't even know where that comes from. In all 35 of my years, I've never seen that. 35 years in practice, I've never seen
I
that.
don't want to see that.
Well, if I'm understanding what we're all thinking correctly, we're not seeing where there is a restriction. Am I correct?
That's
on-
what
on
I'm
that?
thinking, is that there is no restriction as far as anything that's not listed in C
Yeah.
or A. I would think that if a parent brings, I don't know, that if Marty might know if, and the state doesn't restrict that.
No, ma'am.
So it's,
Okay.
as far as I'm concerned, whatever the state, we usually follow the state guidelines, so I don't have a problem with, and I don't even know that we have to reword it. What do you guys think?
I think if there's a question of our regs online being outdated, we
Yeah,
should
maybe
certainly
we should-
update it.
You're right.
Yeah, if we need to
we can
update it.
reword for
When was
clarity.
this last updated?
There's no date on it.
2019.
Really?
Yeah, you guys,
Oh,
Yeah, 'cause I
Okay, I remember that.
I could have swore,
Okay.
I could have swore
it
voted
was
on
to
this.
include the microblading.
Microblade.
Yeah,
Oh, yeah, the microblading.
So let me ask
Okay.
this, if we reword it for clarity, so that there's no ambiguity, that would protect practitioners who have the same question. Whereas if we just kind of leave it ambiguous and something comes up, they could look at this and say, well, it's not explicitly allowed in this. So would we be open to rewording if we decide to make this permissible?
I personally don't have a problem with it myself.
No, I
But
don't
I
either.
wouldn't go any lower than 16 with parental consent.
Yeah,
I know
was,
Connecticut does, they even do tattooing at 14 with parental consent.
Yes, not in
But,
our shop, no.
no, and I agree with that.
where would we want to include that in the regulation, and how would we want to word it?
What are we adding?
I would think it would be in exemptions. We want to make it so that a parent can bring a 16-year-old in and
Kinda like
get
they do
like
at the-
eyebrows, nose piercings, you know.
Kind of like they do at Claire's.
Yeah, well, not even, you can bring a 3-year-old to Claire's and
No,
get
that's what
their
I'm saying.
earlobes pierced, you know what I mean?
started at 6 because I
So-
want the child to know what.
Yeah.
it's for.
So, I mean, how, I don't know, like,
I didn't think it was explicitly permitted, or prohibited in there.
it's not, but it's not in our wording, like, in the exemptions.
I'm
it-
sorry,
it-
I'm late.
It puts a ton of different piercings here, there's a ton of different kinds.
The
but-
ones that you can't do, right?
Ones you can't do.
Uvula piercing.
And then, of course, genitalia and under 18, that's in the restrictions. And then the exemptions are earlobes. So where would we add that? In an exemption?
And if you wanted to add.
Any facial
adult
piercings?
parental consent for specific piercings, it would, the easiest way to do it would be to put it in the exemptions for that. It would just be nose through the nair itself, because I don't think they can do the, what
The
is it?
septum?
The septum.
Why not? Would you do septum on a 16? I would do a septum on a 16-year-old.
Then I would just say, then just keep a blanket to nose. Exemption would be nose, eyebrow, lip,
I mean, we could just say all facial piercings and cartilage.
to
Because
exclude.
that does, because lobes means down here, and there's no cartilage
You
there.
can't do facial, because I remember Marty told me this last time, there's like something here, you can't.
Yeah, we have
What, your
it
eyebrows?
expressly forbids eyelid, which is,
Oh, okay.
Well, yeah,
That is in
exactly.
there? I didn't see
Yeah,
that.
there's-
If it were to
I didn't
help
see
out,
eyelid.
I could sit with Marty.
Oh,
and
there it
make
is.
I'm gonna have some expectation management on you on this one, big guy. I'm dealing with a global pandemic in the office right now, and this is, well, super important to you and my friends at Skin Deep. It just ain't gonna make the cut for a little while. So I will get to it as soon as humanly possible, but like, when I can sit down, I'll take you up on that. But I mean, it's like,
Up until then, may I, going forward, can I do earlobes, cartilage?
we can, well, what it would be is, then you guys would.
Make a motion on
And then
that.
approve it, it would go into the minutes, and then the specific wording I'll come back with as soon as I can.
And then he has to come back with the wording. We have to And then it has to go to town lawyer after that.
Yes.
And then it becomes a regulation, so
Right.
it is a process.
Yes.
I mean,
But
I think as of right now, it's not expressly prohibited, so certainly over the age of 18, you should be able to go
Yeah.
ahead.
Over the age of 18, I'm fine. I've
Yeah.
been turning away about, well, the last 3 weeks that I've been there, $700 or more a week in just earlobe piercings that are going to Weymouth and Brockton and Rockland.
But-
Just for
But,
earlobes?
yeah, you,
Wow.
And
so,
you can
I mean,
do
again, if I'm
earlobes.
reading this right, you can do
Yes, you
earlobes.
Yes,
in
you
Abington.
can do
Yeah.
those. Don't turn them away.
Yeah,
But you know, of
absolutely.
course, the reg online isn't updated, so if he's going by the letter of the law, I can see why he's turning it away. But it's money we're turning away
What's that?
in a time where businesses are shutting down, so.
It's not updated online? It's-
No, I just.
We don't have this
as-
one
as-
online?
As we were,
That,
as we
that
were sitting
regulation
here.
is online.
Yeah,
I-
as we were sitting here, I did check, this is the up-to-date
Okay.
one
All
online.
right.
Okay,
Okay,
Here, my guy.
all right, just making
yeah.
sure.
But he's doing the right thing, like he's being careful, that's what we want.
Yeah.
Michael may have the outdated one as well.
But yeah, people are hurting for money.
Yeah, so that should be
I know.
permissible.
It's a
Yeah.
process to get the whole legality.
Okay, so you should be all set for going forward with earlobe, 18 and over.
And
That's
It's
not,
not expressly prohibited.
exactly, yes.
Correct.
And then if we wanted to make a motion, that's a separate,
And Matt, we can work together. You have my email.
Do we have to make a motion with all, can we say all facial piercings excluding the eyebrow
Or not the
And
eyebrow, the
cartilage?
eyelid, yeah.
or eyelid?
I
Or
would
do we
caution maybe
wanna-
all facial
Give 'em a-
piercings excepting what is listed in,
Yes.
Expert on
Oh,
it.
yeah.
What's
Section
in our
4
exemption?
Yeah.
or,
Yeah.
restrictions, yeah.
Yeah, in section
Okay.
4C.
because otherwise somebody will come up with a new type of piercing.
All right, so I'll,
Well, you can, anywhere you can pick up skin, you can pierce.
all right, so
Just so you know.
I'll make the motion to add to our exemptions, so it would be 3C. I make a motion to allow all facial piercings except for the ones restricted in 4C,
I'll second
if that
the
makes
motion.
any sense.
To 16-year-olds with parental
Oh,
consent.
to 16-year-olds with parental consent. Thank you, Linda.
I'll second that motion.
All right, all in favor?
Aye.
All opposed? All right, motion passes.
And as soon as Marty gets time, he'll get the ball rolling on it.
And then have the, yes,
Yeah,
I'll be in touch with it. As soon, well,
okay.
Thank you, Matt. Thank you. Okay, next item on our agenda is COVID-19 update. So,
all right.
to Marty.
Please stay home when you're sick. And Lindsay, our public health nurse, also asked me to say that. And then I'm going to say, please understand that a negative COVID test does not free you early from quarantine. Lindsay also asked me to say, the public health nurse also asked me to say that a negative test does not release you from quarantine early. This is one of the things we're running into a lot. People believe that they can go back to work or that they can go back to school because they have a negative test. That is not the case. You must stay for your entirety of the quarantine despite a negative test. So when we updated the numbers today, it was 18 positive cases in town. Right now, we're at 21, but a lot of them should come off tomorrow as well. So we might actually end up with the same number today as we had, or tomorrow as we had today. So there's a lot of fluctuation on that as we update everything. And remember, one of the distinctions between our office and the state's office is it is moment to moment in our office here. It is the lag time for a running 2-week total for the state. So when you ask us exactly how many people in town have, or how many contacts we have, or how many people we're tracing, it is the most up-to-date number that me and Lindsay can provide. All right? The state's going to always necessarily, because of the data reporting mechanisms, they're going to lag behind. So that's why our map may not be indicative of our current state, if that makes sense. And there's some other things. If you need COVID testing, call us. I can arrange it either in town or on free with a lot of resources we have in the surrounding communities and some in here. If you're willing to pay for it, we can do it a different way. But the point is, we have infrastructure in town and the resources to send you elsewhere to get tested rapidly. And the appropriate test, not the antigen. We can get the PCR, which is the gold standard, which counts in every part of the world as a positive test. And I can't stress this enough, please stay home if you don't feel well. If you think it's just allergies, take a moment, take a deep breath, have a look in the mirror and say, is it really just allergies? Should I just stay home today? Because if it's not, you'll save a lot of people a lot of heartbreak and a lot of hassle, and save us a lot of phone calls. The school community, I want to give another COVID shout out to our excellent nurses and the school administrators for just, it is an unprecedented level of communication. Everyone has been really, really great to work with, the town hall staff and the library too. And I can't forget my friends at the library. Unless there's any specific questions to COVID-19, I don't really have any more of an update.
On the subject of COVID-19 and the Abington Library, you do have a letter that they sent the board that I'd like to read real quick. Dear Chris, the members of the Board of Library Trustees and Library Director Deborah Grimmett want you and the other members of the Board of Health to know that we very much appreciate the knowledge and expertise of Public Health Director Marty Golightly. Marty's help has been invaluable as we navigate the uncharted territory of providing library services under COVID-19 protocols. His calm demeanor, steady manner, kindness, and concern for both library borrowers and our staff have helped us to minimize public health risks and still achieve our primary mission of providing physical borrowing of books and limited computer access for our residents. The Abington Public Library is ahead of the curve in providing open browsing for our patrons. We were one of only about 20 public libraries in the state who were open for browsing in July and August. Many patrons, especially senior citizens, have mentioned how important being able to browse the shelves and select books to borrow is to their mental health. We are grateful for Marty's assistance, which helps us meet the needs of our residents. With kind regards, Henry DiCarlo, Chair, Board of Trustees.
Well, that's very kind of them, and I sincerely appreciate the words. And I don't know if a lot of our residents understand what a valuable service the library provides to kids and adults in our town. So they're fabulous. Thank you.
We'll keep that going. Next item on our agenda is flu clinic update.
So our flu clinics continue for children. Wednesdays, if you want to get your daughter or son or other immunized, we still have appointments available for this Wednesday, and we're going to do it again next Wednesday. We're going to do it until we run out of immunizations. Until we run out of shots, we're going to do it here in the building. Our adult clinic, it is the most frustrating runaround I have ever been a part of, and I was in the military for 20 years. I have been a part of some frustrating runarounds. We were supposed to have our vaccine on the 7th, then again on the 15th, and now it's soon. I don't know what soon means at this point, but we're still hopeful to have vaccine for our adult clinics and several of them before the end of the month. I'm starting to get doubtful, but you know, National Flu Day is coming, and I hope to have them before then. So that's really it. Call us if you want your child vaccinated. We can help you with that here. That's been a real positive program, and we're doing the best we can.
You have to
with
make
that.
an appointment?
Yes, please, because there's
Yes.
some pre-registration that
Okay.
has to come, and we'll send you an email and all the paperwork associated with it. And because voting is also happening here at the same time, it really helps with us cutting down the crowds.
Excellent. Any questions or discussions on the flu clinic? Final item on our agenda is Halloween statement / discussion. So this has been a hot topic on the
Yeah.
town pages on Facebook.
It has. Halloween is by far my favorite holiday.
Mine as well.
Trick-or-treating is a high-risk activity. Just keep that in mind. Handing out candy to kids as they come to your house is also a relatively higher risk activity. House parties, we all know that house parties are a high-risk activity for spreading events. I would ask that our residents please exercise extreme caution and good common sense. I have a statement here that, with the board's permission, I will put on the website. either first thing tomorrow morning or sometime tonight, and I'll send it to everybody so we can post it on our social medias. A Halloween mask does not necessarily count for one of these, so please double up. Wear your awesome spooky season mask over a functioning cloth or paper mask. Again, please, house parties and leaving the house sick and, well, actually, it's just group activities were one of the causes of our recent spike. So keep that in mind as we approach the Halloween, the end of the Halloween spooky season.
Be safe, be smart,
Yeah.
be spooky.
Yep.
There's lots of little tricks and things that we can come up with to still, you get your kids some candy, but just please, wash your hands, stay away from people as much as humanly possible. Stay home when you're sick. There'll be many more Halloweens than when you're 44 like me and you're still celebrating them. It's awesome, Please do so safely.
Awesome. So that'll be up shortly on our website and social media, so keep an eye out for it.
It's already on my social media, so I already got the message out.
Okay.
Excellent. Any further discussion or questions on Halloween or trick or treat? It's on October 31st, just in case anybody.
Yes.
Yes.
Saturday.
Saturday. it's
Saturday.
gonna be a full
One
moon.
Halloween.
If that is
I'll
all
make a-
on Halloween, I will.
Motion to adjourn?
I'll second it.
All in favor of adjourning, say aye.
Aye.
All opposed? None. Meeting adjourned.
All right.